Hello everyone, welcome to my channel Nurse Educator. In today's video, let us discuss about vital signs, that is part 2. In the part 1, we have discussed about temperature and pulse. Okay, so in last video we have also discussed about what are vital signs. These are signs of life. There are 4 vital signs: TPR, BP. We have also discussed about temperature. It is the balance between heat production and heat loss. There are 2 ways to measure body temperature. We have also seen about the apparatus which is used for measuring the temperature. Then we have seen about pulse, the second vital signs, that is alteration in the rise and fall of the artery, also known as heart rate. We have discussed about characteristics of the pulse. The first was rate. The number of pulse per minute or beats per minute is called as rate. Okay. In the last video, I have not detailedly explained about the second characteristic and the third characteristic, that is volume. The fullness of artery is called as the volume. The force of the blood that is felt during each beat is called as volume. The stroke volume is the amount of blood ejected by the left ventricle during or in each contraction. Usually the normal stroke volume is 70 ml. We'll also see some abnormalities in the volume, such as bounding pulse, water hammer pulse, weak or thready pulse, and paradoxical pulse. The third characteristic is rhythm. It is the regular pattern of pulse in specific time frame, or regularity of heart rate. Okay, regular heartbeat. Okay, we'll also call it. The normal cardiac cycle duration is 0.8 seconds. We'll also see some abnormalities in the rhythm, such as arrhythmias, atrial fibrillation, ventricular fibrillation, and sinus arrhythmias. Okay, for detailed video you can see my description box. Then we'll start with the third vital signs, that is respiration. What is respiration? It is an act of breathing, nothing but एक act है for breathing. Okay, it is a physiological process where individual is inhaling oxygen and exhaling carbon dioxide for viability. Okay, what the person is doing here, he's taking the oxygen in and exhaling the carbon dioxide out. Okay, inhaling in is called as inspiration, exhaling out is called as expiration. Okay, then for physical examination, how we are going to assess the respiration? Okay, we are assessing the respiration by inspection method. Okay, during the physical examination, okay, we will observe the patient's chest for the movements and we are counting the respirations. The respiration regulatory center is present in the medulla oblongata. Then we'll see what are the characteristics of pulse. The first is rate. The number of times the person is breathing air in and out per minute. Okay, it's called as rate. The normal respiration rate in adult is 12 to 20 breaths per minute, usually 16 breaths per minute. Normal respiration rate in newborn is 30 to 60 breaths per minute or 40 breaths per minute. Okay, the normal respiration rate is called as euponea. Okay, we'll call it as a euponea. And tachypnea is the respiration rate more than 24 breaths per minute. Okay, if the respiration rate is increased more than 24 breaths per minute, it is called as, the terminology is called as tachypnea. Bradypne, when the respiration rate is less than 10 breaths per minute. Okay, it is less than 10 breaths per minute, that is called as bradypnea. Okay, then the next characteristic is depth. Okay, it is estimated by observing or inspecting the movement of the chest. Here we are observing the chest of a patient. Okay, so what we are observing here, we are observing for deep breaths and swallow breaths, and also for forced breath. Okay, if the person is breathing deeply, okay, deep in the sense the person is fully taking the air in. Okay, swallow breaths, when the person is in rest, he is taking the breathings very normally. Forced breath is the person is during in an activity, okay, like during exercise, or he's excited or alerted, so suddenly, so here the heart breaths are increased, that is post breathing. Normal tidal volume. Tidal volume is nothing but in each breath the amount of air is going in and coming out is called as normal tidal volume, that is 500 ml. Okay, the 500 ml of air is moving in and out of the lung, that is called as the normal tidal volume. Okay, then we'll see the next characteristic, that is rhythm. Rhythm is nothing but the symmetry of the respiration. You know the symmetry is nothing but correct or normal shape. Okay, during each breath the shape of the chest should be equal. Okay, equal interval between the both or two respirations. Okay, in and out respiration के time पे the symmetry of the chest should be equal. Okay, so in some abnormalities or in some medical conditions we'll not see the symmetry equal. Okay, for example in the pneumonia or in the pneumothorax or also in the condition called as pleural effusion. Okay, so here one side of the chest or one side of the lung may have some abnormalities because of these conditions, so the symmetry of that side might be varying. Okay, so we'll see the symmetric shape of the chest. Okay, then we'll see the fourth vital signs, that is blood pressure. It is the force exerted by the blood against the wall of the blood vessel. Okay, here the force of a blood is going to be exerted during the blood vessel, so that is the blood pressure. The normal blood pressure in adult is 120 to 80 mm of Hg. The BP is taken in supine position. Okay, that is the first priority, and in the sitting position. Okay, then BP apparatus. BP apparatus is sphygmomanometer. Okay, the maximum range is 300 mm of Hg. Usually we are preferring the left hand for the measurement of the blood pressure. We hold the BP apparatus and arm at the heart level. Okay, BP cuff can be applied 2.5 centimeter above the antecubital fossa. Okay, in the antecubital fossa, we are using a diaphragm of a stethoscope to palpate the brachial artery. Okay, so here we are going to hear the brachial artery. So by this brachial artery, we are going to assess the blood pressure. Okay, so the apparatus of to check the blood pressure is the sphygmomanometer. It is ranging for 300 mm of Hg. Okay, there are three types of sphygmomanometer: manual sphygmomanometer, digital, and pediatric. Okay, these three are available in the hospital settings. Usually, digital might not have the accurate readings. So, if the person is serious or you have to check blood pressure continuously, for that person you can go for the manual blood sphygmomanometer. Okay, then we'll see what is systolic blood pressure. Systolic blood pressure or SBP is the highest degree of pressure during ventricular systole. Okay, the first sound which we are hearing during the checking the blood pressure is the SBP, that is Kortikoff sound. Normal SBP is 120 mm of Hg or 16 kilopascal pressure. The diastolic blood pressure is the lowest degree of pressure during ventricular dystole. Okay, the last sound which we are hearing during the checking the BP is the muffling sound. Okay, the normal diastolic blood pressure is 80 mm of Hg or 11 kilopascal pressure. Okay, understood? The normal SBP is 120. The normal DBP is 80 mm of Hg, that is 16 and 11 kilopascal. The 1 kilopascal is equal to 7.5 mm of Hg. Then we will see what is pulse pressure. Pulse pressure is difference between SBP and DBP, that is 120 minus 80, that is equal to 40. Okay, the normal pulse pressure is 40 mm of Hg, that is 5.3 kilopascal pressure. So this was the last slide. Thanks for watching the video. Please like, subscribe and share my channel.